SARS-CoV-2 infection could lead to an exaggerated immune response, leading to severe oxygenation mismatch. Oxygen support is thereby required to treat acute hypoxemia. High-flow oxygen through nasal cannula is indicated to provide as much as 70 liters per minute of oxygen for very severe patients. However, such oxygenation support could be insufficient at some point for the most severe patients, and positive pressure ventilation using either a nasal or an oronasal mask could be necessary to optimize gas exchanges. Current recommendation suggests that a 15 liters per minute oxygen flow rate would be sufficient to reach a 100% FiO2, which means that the patient is inhaling pure oxygen. Nonetheless, in clinical practice, higher oxygen flow rates are frequently needed to match the patient's oxygen requirement. Hence, a 15 liters per minute oxygen flow rate could be insufficient to provide pure oxygen to the patient through the positive pressure ventilation system. Moreover, unintentional mask leaks are very common, which could further reduce the real oxygen supplementation provided. To address these assumptions, we performed a bench study using a positive pressure ventilation device, with an external oxygen supplementation, connected to an artificial lung. We investigated the FiO2 in the gas mixture administered to the patient using several oxygen flows, 5, 15, 30, 50, 60 and 80 liters per minute. Secondly, we aim to report the impact of mask leakage on the FiO2. Our results highlighted that a 15 liters per minute oxygen flow rate was insufficient to reach a 100% FiO2. The actual FiO2 was 75% without mask leakage, and 45% with mask leakage. To reach a 100% FiO2, an oxygen flow rate ranging from 30 to 50 liters per minute was required in the absence of mask leakage. In case of mask leakage, oxygen flow rate ranging from 60 to 80 liters per minute was needed. In clinical practice, those results suggest that in severely hypoxemic patients, an oxygen supplementation flow rate higher than 15 liters per minute applied to the positive pressure ventilation device could be necessary to improve patients' oxygenation. This study took place at Havre Hospital. The bench has been funded by ASTEN Santé.